Hello, and thank you for choosing to view our video today, Bath, Brush, Book, Bed. My name is Betsy Hillyard, and I'm a program coordinator for the Center for Children's Health, which is led by Cook Children's Healthcare System in Fort Worth, Texas. Today, we're going to talk about a simple way to structure your child's evening routine. This is based upon a wonderful presentation and program from the American Academy of Pediatrics titled Brush Book Bed, and we simply added in the bath step because we know that bath time can be a common part of your child's evening routine. So we're going to talk about some of the benefits of a routine like this, as well as some important safety tips. And speaking of safety, I just wanted to mention that I'm not wearing a mask. I wanted to be able to speak clearly for you today and to be able to be seen. So I'm in a classroom in my office building with the door closed with no other staff around. So I'm maintaining a safe environment for myself and for my coworkers. So just wanted to mention that to you. So we're going to go ahead and get started. So how often when you mention bedtime at your house, you get a face that looks something like this? It's very common. We know that that can happen. Um, so we want to talk a little bit about the benefits of routines. Routines are just that. It's important that routines have room for flexibility. You're not trying to schedule every minute of every day for you and your child. So they have some flexibility, but the important thing is that they offer predictability for your child. They provide babies and toddlers and adults as well with a sense of security and certainty. The child learns to expect that after the evening, maybe after an evening meal and a few minutes of playtime, then we begin our bedtime routine of taking a bath. It increases the trust that the child has in their caregiver. Again, when the baby knows what to expect, it helps him or her feel more comfortable and have trust in their caregiver and in their environment. It helps children be independent and encouraged to try new things. Occasionally, routines can help decrease challenging behaviors. Transitions can be very challenging for children, especially if they're having fun playing and then all of a sudden their fun is ended because it's bath time. So if a child knows I can play with my toys for a few minutes, or I can do a favorite activity for a few minutes, but then they know that bath time is coming, it helps to decrease that stress around the transition time. And then of course, all of these routines, we'll talk about this, but the aspects of these routines offer an opportunity for bonding. There's an opportunity for language development as well. The child can learn sequencing. So we learn that after we take our bath, what's next? We brush our teeth. Very good. What do we do after we brush our teeth? We read a book, and so on and so forth. And just adults, it's very helpful if all of the people that are caring for your child are familiar with this child's routine. It can make things easier for everybody. And if a child learns that there's one certain caregiver that kind of lets things go by the wayside, possibly, lets them skip brushing their teeth or skip their bath, the child is going to remember that. So helping to keep routines will help all of the caregivers have an easier time. So with that, we're going to talk about the first part of most people's evening routine, which is the bath. And like I said, we're going to be talking a lot about the safety aspects of your evening routine. So for this, we're going to talk about drowning prevention because sadly, children can drown in as little as 1 inch of water. So if you kind of look around wherever you're sitting, do you see a coffee cup, a sippy cup, maybe a bottle or a water bottle that has just about 1 inch of water in it? Use that as a visual. That's how much water it can take for a child to drown, just enough to cover their nose and their mouth if they were to be face down in the water. So that's why bath time, we really want to focus on safety for this. So here are a few tips to kind of make bath time a little safer. You definitely want to separate bath time from other chores in the house. So doing something like putting the baby in the bath and then running to start a load of laundry or cook dinner. It's not recommended. You want to be able to have an adult who has their entire attention focused 100% on the child or children in the water during bath time. Because children can drown very quickly. And they drown without a sound. Often on television or in movies, a person who's in distress in the water will splash around and yell for help, but in reality, children drown without a sound. You want to be prepared for the bath. So what that means is you want to make sure you have all of your supplies handy. So before the bath, make sure you have your soap, your towels, all the toys that your child wants. You want to have your pajamas and diaper, all of that within arm's reach for you while you're giving your child the bath. You may want to try using a plastic tote to keep all of your supplies together so that as soon as bath time starts, you can just go ahead and pick up that tote, take it into the bathtub or in the bathroom with you, and you have all the supplies that you need. You also may look for something like a bathtub kneeler. If you look at this photo, you can see that the adult is kneeling on a nice padded surface, which is a little more comfortable on your knees than just a hard bathroom floor. And this particular bathtub kneeler has pockets in the front. So you will literally have all of your items you need right there within arm's reach. So there are products like that you can find at any store that focuses on selling baby items. You can look online for a bathtub kneeler. They can be very handy. They can keep everything organized and save a little wear and tear on your knees. But we all know that we can be as organized as we think we want to be, but we forget things from time to time. So if you do find yourself in the bathroom with your child and realize that you forgot something, you're going to want to pick up the child and take the child with you to pick up the forgotten item. Because you always want to stay right there with your child. Also, bath time supervision, that's a task for an adult. This isn't something that you would want to put an older sibling in charge of. Bath time can be a really fun opportunity for learning and growth and development for you and your child. I mean, you can see even in this photo here, the baby is locked eyes with the parent. So whatever that parent is saying, that baby is zeroed in on. You can introduce concepts, kids love to, when they're in the bathtub, to have a cup and they fill it up and they dump it. And they fill it up and they dump it. So you can start using words like, oh, your cup is full. Oh, now your cup is empty. Okay, well, baby's cup is full and now mommy's cup is empty. So you can start introducing concepts like that. Also just using language throughout the bath. Even just simple things like, ooh, the water feels warm. This sponge is green. Your pajamas have trucks on them. Things like that can help to introduce additional language opportunities and learning for your child. Okay, so after the bath, and again, this is something, we talked about flexibility. You may want to brush your child's teeth before the bath. Whatever is going to work best for you, your child, your family, you'll want to go ahead and make that routine comfortable for you. So the image on the left shows a little baby who doesn't even have teeth yet. And sometimes parents think, well, I don't have to brush my child's teeth if they don't have any, which is true, but you still need to clean your baby's gums after feedings and especially before bed. So I'm going to demonstrate this very quickly for you. So I have here my friend little baby doll here. A great way to clean an infant's gums after feeding is to take a clean, soft cloth, just like a simple washcloth. You can pick up multi-packs of these at any store. You want to make sure it's nice and clean. Get it just damp. Doesn't need to be dripping wet, just damp. And then you want to open the baby's mouth. You want to wipe the bottom gums and the top gums. What that does, we understand that your baby may not have teeth yet, but what that does is it helps make sure that when those teeth do come in, they have a nice, clean, healthy mouth to grow into. Once that first tooth comes in, which is about at 6 months, you can begin brushing 2 times a day with a soft toothbrush. And just by the way, this is a great time to go ahead and schedule that first dental visit. While you're brushing or cleaning your baby's gums, again, you can talk with your child about what you're doing. You can go ahead and tell your baby, okay, let's brush your teeth. Even if your child doesn't have teeth right yet, chances are he or she doesn't know that. So as you are, using those familiar words, as your child does start to get teeth, when he or she hears the phrase, okay, let's brush your teeth, they'll know that it means time that my grown-up's going to be cleaning the inside of my mouth. So I need to open wide. So starting something like this, starting oral care early, is very important. It can help your child be a more willing toothbrusher as they grow up, and can set the good routine for good oral health care habits throughout the lifetime. Okay, so we have bath done. We've brushed our teeth. The next thing we get to do is story time. Reading to babies and toddlers can have huge benefits, not just for the child, but for the parents as well. It's obviously a wonderful opportunity for snuggling together, reading a book together. This is some of, parents will say this is some of their favorite bonding time. It can develop a love of books and a love of reading. We all want to encourage children to grow up to love books and reading and learning. What's nice too is that this can give your child an opportunity to have choices and to have some control. So for that, you can give your child suggestions like, okay, which 2 books do you want to read tonight? And your child can choose one book, and then you can remind them that, okay, we've got 1 book, we need 1 more book, and then we'll have 2 books. So you're giving your child the choice of which books they want to read, also getting to know some number skills. You can also give your child the choice like, okay, would you like to snuggle together on the bed to read our books, or would you rather sit on the floor tonight? So giving your child opportunities for choices like that helps to develop his or her confidence and gives him or her a sense of control. So reading can be fun. It doesn't have to be just looking at the book and reading the lines, line after line after line. It's okay to have some fun with it. You can act out the book. I've known parents that have given the characters different voices. So maybe the lion has a very deep voice, and then the mouse has a little teeny tiny voice. I did bring a favorite book today. This is Little Blue Truck. When you have portions that rhyme, it's a great way for the child to kind of be able to learn the words and fill in the blanks. So on this page, it says, they couldn't quite budge that heavy load, but who hopped up but the big green? And if you pause, it gives your child an opportunity to answer fill in the end of the line. If your child's not quite speaking yet, maybe they start to babble. And that's great. Your child is learning the language rhythm. So even if they don't say the big green toad, if they go da, 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 they're learning the rhythm of language and sentence development and all that fun stuff. Another thing you can do is, if you're reading books at nighttime, your goal is probably to get your child to start to wind down, get a little sleepy, a little drowsy. So you can lower your voice and slow your voice just like I did right there to kind of match the affect and the behavior that you want your child to have. So for example, in this book, a hiss, a jolt, a sway, now the journey's underway. The train's departing, car by car, the headlight fades into the stars. Puffing, chuffing, out of sight. Steam train, dream train. Shh, good night. And again, we talked a little bit about transitions at the beginning of the presentation. And that right there, when you talk about steam train, dream train, shh, good night. That's a wonderful opportunity to transition your child into the bed. Again, I did mention that we're going to talk about safety today. So I want to take a moment and encourage you to look at this photo. This photo is set up, obviously that's a baby doll in the photo, but there are items in this sleep environment that are unsafe. So I want to encourage you to take a moment, look closely at the photo, see if you can identify the portions in the sleep environment that are unsafe. And I'm going to give you a hint, there are 7 of them. Okay, so hopefully you've had a moment at least to identify a few of the unsafe things that are the things that can be unsafe in this photo. So we're just going to walk through this pretty quickly. One is the bumper pad. Bumper pads can become untied or unvelcro and cause a suffocation risk for the baby. Also, if baby is beginning to roll and baby gets his or her face pressed against the bumper pad, that can also pose a risk of suffocation. That blanket, it's a pretty pink, fluffy blanket. It's really cute and soft. But again, if baby moves during his or her sleep, the blanket can unch up and cover their airway and cause a suffocation risk. Same thing with the stuffed animal. Those are cute and pretty and soft, but if that elephant were to tip over, or if baby wiggles up and gets his or her face pushed up against a stuffed elephant, it can be dangerous. One thing that may be hard to notice in this photo is that the baby's head is raised up on a positioning wedge. The positioning wedge, again, if baby moves around and slides off of the wedge, the face can be trapped alongside or under the positioning wedge, which can be dangerous. Baby can also slide down. With this particular situation, if the baby slides down and we have a blanket in the crib as well, that can be a dangerous portion as well. Now, we do want to point out that there are medical conditions that would require a child to have a positioning wedge, which would elevate their bed in the crib. So if your pediatrician has recommended, we always definitely want to discuss these types of needs with your pediatrician and follow the advice of your pediatrician. Another thing in the photo that might be difficult to see is that the crib sheet that's on the crib is very loose. So if baby moves around during sleep, it can cause the corner of the sheet to come loose. And as baby's moving around again, it can cover their face and nose and mouth and cause a suffocation risk. The pillow, same thing. And another thing that sometimes people are surprised about is the hat. People think, well, it's on the top of their head. Why would that cover a risk of cause a risk over their nose and mouth? But again, as baby's moving around, if the hat comes off during sleep, it can cover the baby's nose and mouth again as well. So definitely want to ensure that your baby is in a safe sleep environment. What that looks like is basically just an empty crib with a tight-fitting crib sheet and the baby in just pajamas or a sleep sack alone. If you're worried about the baby being cold, it's best to warm the room and not the baby, him or herself. All right, so just want to thank you again for viewing our video. I hope this has been helpful for you. Again, I do want to reinforce that these are just general tips for safety. If you have any questions at all about your child's development, your child's growth, safety, anything like that, definitely talk that over with your child's healthcare team. But again, thank you for taking the time to watch this video and for all of the work that you're putting in to raise healthy, thriving, beautiful children here. You're doing a great job, and just go hug those little ones. Have a great day.